Hello and welcome everyone. I'm Dr. Natalie Teo, a urologist specializing in men's health, and I have been practicing for more than 30 years already. Today we are going to talk about something that, I tell you, generates so much controversy, so much curiosity, so much anxiety, and unfortunately so much misinformation. We are talking about penis size, what is actually normal, how do you measure the length and circumference properly, and most importantly, should you even be worried about this in the first place? This topic for the longest time was considered taboo one, but now it is coming up more and more frequently in my clinic here in Singapore, on online forums, on social media, especially with all these advertisements for male genital cosmetic procedures popping up everywhere. You scroll Facebook, also got, you watch YouTube, also got. But before I continue, I want to reassure you with one piece of information that might actually shock you a bit. Approximately 95% of men who worry about the size of their penis are actually within the perfectly normal range. Yes, you heard me correctly 95%, the vast majority of the time, it is not a real physical problem at all. It is a completely distorted perception of your own body. So many men feel inadequate because of completely unrealistic comparisons, particularly with what is shown in adult themes or on the internet, where bodies are systematically exaggerated or even digitally enhanced. Everything is airbrushed, everything is made to look bigger than reality. And here is another statistic that might surprise you even more. This masculine concern is hugely overvalued one. While more than 50% of men say they are anxious or dissatisfied with their size, only 5 to 10% of women consider penis size to be a very important factor in a relationship. You see the disconnect or not? So take a deep breath, relax a bit. My goal with this video is to educate you, to inform you, and most importantly, to help you have a clear and realistic view of your own anatomy. We are going to go through real scientific data based on 15,000 men studied worldwide. I will teach you how to measure your penis correctly because most people do it wrong one. We will discuss enlargement procedures and their real risks, and I will share with you a historical revelation that might completely change your perspective on this whole thing. Leave me a comment and tell me where you are watching this video from. I want to know which men out there have the courage to confront the medical truth today. I get viewers from all over, from Singapore, Malaysia, Indonesia, Philippines, even from UK and Australia. So do not be shy, just share where you are from. Let us start with the basics. How is penis size actually measured? How do you measure your penis correctly? This is absolutely essential to know where you really stand. There are two main dimensions to consider, the length and the thickness, also called the circumference. First, let us talk about measuring length. It can be measured in both erect and flaccid stretch states. Both methods are used in scientific studies, but the most clinically reliable one is the stretch length at rest because it corresponds almost perfectly to the length when erect. This is what we use in medical settings because it is more consistent and does not depend on the level of arousal. Here is how to do it properly. Use a rigid ruler or a measuring tape. Place it starting from the pubic area where the penis joins your body at the top. You might need to press slightly into the fat pad to reach the bone. This is important especially for those of you who carry a bit more weight around the midsection. Then stretch the penis outward firmly but without forcing it and measure to the tip of the glans, that is the head of the penis. Warning, it is crucial to avoid measuring from the skin underneath or from the side of the penis because that artificially adds length and gives completely false results. I have had patients come to me saying they measured themselves at home and got certain numbers, but when I measure properly in the clinic, the numbers are different. So make sure you follow this method. Now for measuring circumference, which is the thickness, this is also important and varies enormously from one man to another. Take a flexible measuring tape or a piece of string. Wrap it around the middle part of the penis shaft, not too close to the base and not too close to the tip. Mark and note the measurement. You can do this while flaccid or erect, but most medical studies are based on erection measurements because that is when it matters most functionally. The main problem is this: many men overestimate or underestimate their size due to incorrect measuring methods or by comparing themselves with others in different states. You see yourself from above looking down, which creates a foreshortening effect that makes it look smaller than it actually is one. Meanwhile, when you see other men, you see them from a different angle. This creates completely unrealistic expectations and comparisons. So tell me in the comments, have you ever measured correctly before watching this video? Let us be honest, this is a judgment-free space. Now let us look at what the real scientific data tells us. What does medicine actually say about normal penis size? Now that we know how to measure correctly, let us see what real scientific studies reveal. A major meta-analysis looked at data from almost 15,000 men from all around the world. This type of analysis combines multiple multiple studies to get absolutely realistic averages. These are not numbers pulled from thin air or from adult entertainment. These are real medical measurements done by healthcare professionals. For length, when measured in erect position or stretched at rest, 90 to 95% of men fall within a range of 10 to 16 centimeters. That is about 4 to 6 inches for those of you who prefer imperial measurements. The global average is around 13 centimeters or just over 5 inches. This means that if you find yourself within this range, you are part of the overwhelming majority. Why, you are normal lah. There is nothing wrong with you at all. At the extremes, we use specific medical terms. Micropenis refers to an erect length of less than 7 centimeters. This is a rare medical condition that affects less than 1% of the population. On the other end, macropenis refers to anything above 24 centimeters, which is extremely rare and often actually problematic because it can cause difficulties during intercourse. The circumference also follows a predictable pattern. At rest or stretch, it ranges between 8 and 10 centimeters or 3 to 4 inches with an average of around 9 centimeters. When erect, it ranges between 10 and 13 centimeters or 4 to 5 inches with an average of about 11 centimeters. These are the real figures from proper scientific studies. The bigger problem is that most men make comparisons with completely unrealistic standards, particularly from the adult entertainment industry, where actors are selected specifically for their unusual size, and camera angles and editing exaggerate the perception even further. Everything is artificially enlarged for visual effect. The lighting, the angles, the proportions of the actors chosen, all of it is designed to make things look bigger than normal. The message is clear: if you fall within these ranges, you are perfectly normal. And if you fall slightly outside, this in no way defines your health, your attractiveness, or your masculinity. Now, I know many of you, especially those of you who are a bit older, might be noticing some changes. This is something I get asked about a lot in my clinic, so let me address it directly. As men age, there can be some reduction in penis size, and this causes a lot of worry. But let me explain why this happens. First, there is reduced blood flow. As we get older, blood circulation is not as efficient as when we were young. The penis depends on good blood flow for erections, so when circulation decreases, erections may not be as firm or as large as before. Second, there is the accumulation of fatty tissue around the pubic area. Many men gain weight as they age, and this fat pad can make the penis appear shorter even though the actual organ has not changed. This is why the proper measuring technique involves pressing against the pubic bone to get the true length without the fat pad affecting the measurement. Third, there are hormonal changes. Testosterone levels naturally decline with age, and this can affect erectile function and tissue elasticity. The penis may not stretch as fully as it used to. Fourth, there are conditions like Peyronie's disease where scar tissue forms inside the penis and can cause it to curve or bend. This curvature can also make the penis appear shorter. If you notice a significant curve developing, especially if it is painful, please see a urologist. This condition is treatable. The good news is that many of these factors can be addressed. Maintaining a healthy weight, exercising regularly, managing conditions like diabetes and high blood pressure, and not smoking can all help preserve function and size as you age. So do not just accept decline as inevitable lah. There are things you can do, but I know some of you are already thinking about enlargement solutions. Let us talk about this frankly. Now let us discuss the question that many men ask silently or sometimes not so silently. Is there a safe and effective way to increase penis size? First, let me clarify something. It is perfectly normal to be curious about this. We live in a society that constantly bombards men with unrealistic expectations about their bodies. But if you are considering modifying something as delicate as your anatomy, it is vital that you have the correct medical information. Because yes, there are procedures that promise results, but not all of them are safe, and even fewer are actually necessary. Let us start with increasing thickness or circumference. Hyaluronic acid injection is currently the most common method. This substance is naturally present in our body and is used in facial aesthetic treatments. When injected into the penis, it can increase the girth by 2 to 3 centimeters temporarily. The effects last from 12 to 18 months, then the body gradually reabsorbs the material. This method is relatively safe provided it is performed by a qualified professional using approved products. Here in Singapore, make sure you go to a registered clinic with proper credentials. Do not simply go to any aesthetic center just because they offer a cheaper price. This is your body we are talking about. But be careful, not all injectable products are safe. Some centers, especially overseas or unlicensed ones, offer non-absorbable fillers like PMMA, industrial silicone, or other dangerous substances. These products can cause permanent nodules, severe infections, chronic inflammation, irreversible deformities, or permanent damage. I have seen cases where men went overseas for cheap procedures and came back with serious complications that required multiple surgeries to fix. These substances are never medically recommended, never. Now for lengthening the penis, here the possibilities are much more limited and risky. There are two common procedures. First is pubic liposuction. Fat is removed from the base of the penis, which makes it appear longer, but it does not actually change the real length of the organ. It just reveals more of what was hidden by the fat pad. This can be helpful for overweight men, but the results are modest. Second is cutting the suspensory ligament. This ligament holds the penis attached to the pubic bone. When it is cut, the penis hangs lower and can appear longer at rest, up to 2 additional centimeters. But there is a major problem with this. It does not increase size when erect. It can cause instability during sex because the penis is no longer anchored properly. There is a high risk of complications and scarring. And the rate of post-operative frustration is very high because the results often do not meet expectations. This is why the World Health Organization and many international medical associations do not recommend these procedures as a first option. In most cases, the aesthetic benefits do not outweigh the physical and emotional risks. I always tell my patients, think very carefully about why you want this. Is it for yourself, or is it because of external comparisons that may not have any medical basis? Now let me address something that causes confusion: penis implants. Although they are presented on the internet as enlargement solutions, in reality, they are designed to treat severe erectile dysfunction, not for aesthetic purposes. These are medical devices used only when all other treatments have failed. They are not meant for healthy men who simply want to be bigger, so do not be misled by what you see online. I also want to address the products you see advertised everywhere. The pills, the creams, the pumps, the stretching devices. Let me be very direct with you. There is no pill or cream that has been scientifically proven to permanently increase penis size. None. If such a product existed and actually worked, it would be the best-selling medication in the world and every doctor would know about it. The fact that these products are sold through dodgy advertisements and not through pharmacies should tell you something. Vacuum pumps can temporarily increase size by drawing blood into the penis, but the effect is temporary and excessive use can cause damage. Stretching devices or extenders have shown some modest results in a few studies, but we are talking about a few millimeters after months of daily use for several hours. The commitment required is enormous and the results are minimal. My medical recommendation is this: if you are considering any intervention, the best tool you have available is honest and complete medical information. It is also crucial to think about why you want this. Is it really for yourself, or is it because of external factors and comparisons that may not have any medical basis? But before I conclude, let me share with you a historical revelation that could completely transform your perspective on this whole topic. In ancient Greece, the masculine ideal was not associated with a large penis size. On the contrary, men considered wise, strong, and admirable were depicted with small penises. Why? Because this was associated with self-control, rationality, virtue, and intelligence. These were the qualities that mattered to the Greeks. On the other hand, large penises were considered signs of excess, vulgarity, lack of self-control, and bestial behavior. They were associated with foolishness and lack of civilization. If you look at the sculptures from this period, you will notice that neither the gods nor the heroes had exaggerated sexual attributes. Zeus, Apollo, Heracles, all of them are depicted with modest proportions. Exaggerated representations, like in the case of the god Priapus, were reserved for comedy or caricature. They were meant to be laughed at, not admired. In other words, a large penis was not a symbol of power, but sometimes of ridicule. Can you imagine? The complete opposite of what we are told today. What does this teach us? That standards of beauty and masculinity change according to era and culture. What is presented today as desirable could be considered the complete opposite at another moment in history. Different cultures throughout time have had completely different ideas about what makes an ideal male body. And if that is the case, why let something so variable, so culturally constructed, define your self-esteem? Why let a number on a ruler determine how you feel about yourself as a man? I have been practicing for more than 30 years and I have seen thousands of patients. I can tell you that the men who are happiest and most confident are not necessarily the ones with the largest measurements. They are the ones who have accepted themselves, who focus on being good partners and good people, and who do not let arbitrary standards dictate their self-worth. Let me give you my final message. The medical reality is clear. The vast majority of anxieties related to penis size are not based on medical facts. They are based on social pressure, distorted pornography, and widespread misinformation. What matters is not conforming to some external ideal, but having a healthy relationship with your body and your sexuality. Size does not determine your value as a man, your attractiveness, or your real capacity to give or receive pleasure. What truly matters is how you feel in your own skin, how you take care of your overall health, how you communicate with your partner, the respect you have for yourself and for others. These are the things that make a real difference in your life and in your relationships. As your doctor, I want you to understand this. You are not defined by a measurement. You are a complete man with a value that infinitely exceeds the dimensions of your anatomy. You have lived your life, you have experiences, you have wisdom. Do not let something as superficial as a number take away from all of that. If this medical information has helped you see things more clearly, please leave a comment and share what you have learned today. Right, thank you, Dr. Natalie, if this scientific truth has freed you from an anxiety that was wearing you down. And for those of you who are older and have been worrying about changes you have noticed, I hope this video has given you some reassurance and practical information. Remember that many age-related changes are normal and manageable. Do not suffer in silence. Talk to your doctor. There is no shame in discussing these things. Subscribe to the channel if you want more concrete and honest information about men's health, because that is my goal, to debunk myths with science, empathy, and medical honesty. You deserve to know the truth about your body. You deserve to feel good in your own skin, and you deserve to live without this unjustified anxiety weighing you down. Thank you for following me all the way to the end. Take care of yourself and remember, you are perfectly normal just the way you are. See you in the next video.